Welcome back. Joining us now with everything you need to know about Medicare from our sponsors at Univera Healthcare are Danielle Banasak and Renee Sabin-Haggerty. Thanks so much for coming in today, ladies.
Thank you. It's nice to be here.
Of course. Well, Danielle, last time you were here, we talked about some big changes coming in 2025 for Medicare Part D. So do you mind just recapping that for those?
Oh, sure. Thank you. I'd love to. The Medicare members are going to finally have a year with no coverage gap or donut hole phase of the benefit. Fantastic. They've had one since, for at least 10, 15 years. So this is where a good spot for them to save money. Secondly, is for the first time ever, they will have a maximum out-of-pocket cap of a cost of no more than $2,000 on any drug throughout the whole calendar year.
Nice. Okay. Alrighty. Well, let's talk about the Medicare prescription payment plan and how that works. Do you want to tell us about that, Renee?
Sure. Effective 1/1/25, so January 1st, in addition to all of the different things that have come out of the Inflation Reduction Act of 2022, which is a law that was passed that brought a lot of really great new provisions for Medicare Part D members, and those are people with prescription drug coverage, we have something called the Medicare Prescription Payment Plan. And what that program effectively does, first of all, it's completely voluntary. If a member decides to opt in to the program, what it does is it shifts the person paying their expenses at the pharmacy counter. So instead of paying their retail pharmacy or their mail order pharmacy or their specialty pharmacy, they are actually paid nothing at the pharmacy counter. And then the health plan, so in our case, Univera Healthcare, would bill the member in installments for those expenses. So what it does is it takes the amount that's there and spreads it out over the calendar year from the time that they elect into the program. So it's a budgeting mechanism.
Okay, that makes sense because sometimes these prescriptions are very expensive, and to have to pay that all at once at the counter is sometimes stopping people from getting the prescriptions that they need.
You said it perfectly.
Okay. Now, does anyone qualify for this program, Renee?
Anybody with a Medicare Part D prescription drug benefit. So that could be either a standalone prescription drug plan, it could be prescription drug coverage that's offered through an employer group, or it could be somebody that has Medicare Advantage prescription drug that they purchase as an individual contract. Everybody is eligible for the program.
Okay. Now, who is not likely to benefit from this program?
Yeah, that's a great question, along with the question of who is likely to benefit, right? So those not likely to benefit are those that really have either low or fixed expenses. Because if you have lower fixed expenses, it really doesn't matter whether you pay the pharmacy or wait to get billed by the health plan.
Right.
However, when you have somebody that has a high-cost specialty drug, say they take something for multiple sclerosis or Crohn's disease, and it might be $2,000 right off the bat, that might be somebody that needs the ability to budget in installments throughout the plan year so that it's more affordable for them in a monthly chunk versus taking it all at once.
Right.
Yeah, so there's a really nifty tool that's been put out by Medicare, actually, that helps people determine whether they're likely to benefit from the program. You can go to medicare.gov to get that tool, and it's also embedded in our univerahealthcare.com website under the Medicare Prescription Payment Plan section.
Great. Okay, well, ladies, this is really important topics. A lot of our viewers are going to be impacted by this. So where can people find out more about Univera's Medicare programs?
Right, if they actually just go to our website, univerahealthcare.com, univerahealthcaremedicare.com, they can also use the tool to see if they're likely to benefit with the prescription payment plan. They can also look at the different products that they can purchase, whether it is a zero premium plan or one that might have a little bit more, like a $29 premium plan. And they have until actually December 7th for the open enrollment. December 7th is the last day, but they can sign up for a 2025 Medicare plan.
Okay, that's coming up soon, viewers. So if this is going to be impacting you, do the research now, figure out what you need, and make those changes. You guys have given a lot of great information. Medicare can be a little bit confusing and overwhelming, especially for the people that are going to be impacted by it the most, which tends to be our seniors, right? It's a lot of information
Absolutely.
coming out of you, a lot of changes. So I think these segments where we break it down and make it more palatable is very helpful. So thank you, good ladies, for coming in. And viewers, if you have more questions about this new program, our sponsors at the Univera Healthcare can help. You can call the number right there on the back of your card, and it's right there on the screen to talk to someone local about these Medicare Part D changes. Thanks again for coming in.